Hello, everyone, and welcome to the Nemours Children's Health Early Care and Education Resource Showcase. We are so glad you joined us today and are looking forward to sharing with you new resources to support healthy changes in early care and education settings, and also to engage families in this great work that you all are doing. I know we all have the same mission of ensuring that our nation's youngest citizens have the healthiest start in life possible, and we are really thrilled to be on this journey together with you. I am Calisti Chong, a manager here at Nemours Children's National Office of Policy and Prevention. And part of the work we focus on is to improve the nutrition and physical activity policies, practices, and environments in early care and education settings using two primary approaches. So creating state systems level changes and also facility level interventions. You'll be hearing from me a lot today and throughout the remaining sessions in this three-part series. So during today's session, we'll ask for everyone to keep themselves muted. Please feel free to utilize the chat box and share any thoughts or questions that you might have there. We will also do our best to address all the questions throughout the session and at the end. And if we're unable to answer all the questions, we'll reach out afterwards to provide any requested information. Next slide. So this is the first of 3 resource showcase sessions that we'll be offering over the next few months. Today, we'll focus on the Better Together Learning Collaboratives, and we have our great partners at Go NAPSACC at the University of North Carolina at Chapel Hill here with us to share these resources with you. The second session is going to be on March the 7th, where we'll highlight the Nemours Children's Wellness Workbook for Early Care and Education, and also an open source version of our learning collaboratives focused on nutrition and physical activity topics. And I'll share a little bit more about that at the very end. The final session will be held on April 4th, and Nemours Children's staff will be sharing the Nourishing Healthy Eaters training resources and also family engagement materials, including the Better Together Family Cafe Toolkit. All of these sessions will be held from 3 to 4 p.m. Eastern Time, and the recording of each session will be posted on the healthykidshealthyfuture.org website. And we'll also email out the recordings after each session as well. Next slide. So let's jump right into the Better Together Learning Collaboratives. I mentioned that we have our Go NAPSACC partners here with us today. I'd love to take a moment to ask David and Aviva to introduce themselves, since the resources we're sharing with you today were developed and finalized primarily by the 3 of us. So David, do you mind introducing yourself?
Hi, thanks, Calisti. I'm David Yates at the University of North Carolina, Chapel Hill. Go NAPSACC is one of our tools that we use, and happy to have everyone here today. And I'll turn it over to my partner, Aviva.
Hi, my name is Aviva Starr. I'm a Go NAPSACC implementation advisor, and I support the work of Go NAPSACC in many of our partner states. So glad to be here.
Thank you both. We are truly grateful for the expertise and thoughtfulness that the Go NAPSACC team brought to this project, and we definitely took a team approach, to creating these materials. Next slide. So today's agenda includes a brief overview of the Better Together project overall, a review of the Better Together Learning Collaboratives framework. We're also going to share about the available resources and materials through Better Together and how you can access those materials. Then we're going to talk about some implementation strategies. We'll hear from a wonderful partner from Indiana about her plans to implement Better Together Learning Collaboratives in Indiana. And then we should have some time for questions at the end. So we certainly have a full agenda. Next slide. So Better Together was a joint project between Nemours Children's and Go NAPSACC from 2019 to 2022. Better Together was funded by a private foundation to improve healthy eating and physical activity policies, environments, and practices at the state systems level and at the early care and education program level. And we focus training efforts on ECE programs located in under-resourced communities. Next slide. So Better Together was implemented in 4 states. Initially, we started with 3 states that included Arizona, Arkansas, and Mississippi. And then as we experienced the pandemic shutdowns, we took a lot of opportunities to pivot, and we invited Indiana to join us on this journey. Next slide. There were 3 primary components of Better Together, the first being a state-level systems change. So using the Centers for Disease Control and Prevention Spectrum of Opportunities framework as a guide, we provided support to each state that I listed above in the last slide to develop an action plan focused on systems changes. And then we provided customized technical assistance to help each state begin to build partnerships and take action to meet their state's goals. So some examples of spectrum areas states chose to focus on are creating a state early care and education recognition program, building technical assistance networks around nutrition and physical activity topics, and making updates to quality rating and improvement systems in their states, or QRIS programs. The second component was to implement learning collaboratives with ECE programs in each state, which we're going to dive into more today. And then the third component was building statewide Go NAPSACC networks. And I'll invite Aviva to share about this part of the process and about Go NAPSACC in general for states that may not be as familiar with Go NAPSACC.
Great, thanks, Caliste. So Go NAPSACC is an online platform that supports improvements to ECE environments to foster healthy eating, physical activity, and overall development in children. I'll tell you a little bit about Go NAPSACC now, and then show you a little bit of how our learning platform works later. But for statewide use of Go NAPSACC, we thought about how to support childcare programs across the Better Together states in order to improve healthy habits in childcare settings. Go NAPSACC is currently utilized in 21 states. You can see our current map now. It is always changing and growing. And David's going to put in the chat if you want to know if your state for sure is a Go NAPSACC state or not, and you can see who your state lead is so you can reach out to them if you're interested in learning more about Go NAPSACC's work across the country. As we present the learning material today, a few things to know that these are learning collaboratives that have Go NAPSACC fully integrated into their work. And so as childcare providers were coming together to learn about these topics, they then went back to their programs and had times of action where they were using Go NAPSACC to help them create change in their childcare programs. As such, to use the Better Together Learning Collaborative materials effectively, you have to be a state with an active Go NAPSACC license. Just for anyone who's interested, Go NAPSACC costs $30,000 a year for unlimited statewide use. You can email gonapsac@unc.edu to learn more information and just to explore that possibility. But once there is a Go NAPSACC contract in a state, as we mentioned, it is unlimited. So whether that be for this learning collaborative or other ways of supporting childcare around healthy habits, Go NAPSACC would be available to any childcare program in your state. As such, the people leading the Better Together Learning Collaborators need to be certified Go NAPSACC consultants. That means they are aware of the resources and the technical use of the platform and therefore are able to support those providers. Becoming certified as a Go NAPSACC consultant is a simple process. There's a 3-hour training, and part of your contract includes the training of your consultants and the support of the consultants as they work with the providers. For programs that aren't, for states that aren't Go NAPSACC contracted, Caliste can talk a little bit more about the open source resources.
Thanks, Aviva. So like Aviva said, if your state does not currently have a Go NAPSACC license, or if your state isn't planning to get a Go NAPSACC license in the near future, we have taken the Better Together materials and created a version that can be used by any state. And we're going to discuss those materials that we refer to as the open source learning collaboratives during the next resource showcase on March the 7th. So the open source was developed using the Better Together framework that you're going to learn about today. So I think it still would be helpful for you to stick around even if your state doesn't have a Go NAPSACC license, because the learning collaboratives are very similar. Next slide. So what are the Better Together learning collaboratives? Just to give a brief description about learning collaboratives in general, they are a powerful way to support early care and education programs through a process to improve their practices, policies, and environments. I personally am a huge learning collaborative fan, and I started out my journey with Nemours as a trainer implementing learning collaboratives in Alabama about 6 or 7 years ago. So I've seen firsthand the impact that they have made on ECE programs to make healthy changes, and the impact that customized technical assistance that is provided through the learning collaboratives, how much of a difference that truly makes in helping to meet the providers where they are. Next slide. So Nemours has been using the learning collaborative approach with early care and education programs across the nation for over a decade now. And many of you might be familiar with the early care and education Learning Collaboratives project that was implemented from, excuse me, 2012 to 2018. Some of you may have even used the ECLC materials in your state before. So that framework used the paper Go NAPSACC assessments that many of us are also familiar with, and paper action planning tools. So through Better Together, we really reimagined the learning collaborative process and integrated the online Go NAPSACC tools into the updated Learning Collaboratives framework. So you'll see throughout the rest of the presentation how the Go NAPSACC tools are really integrated and are part of the framework of the Learning Collaboratives to walk providers through that Go NAPSACC 5-step improvement process. Then also due to COVID, we really had to adapt the materials so they can be used both virtually or in person, or possibly even a combination of both delivery approaches. Next slide. The Learning Collaborative Framework. So there are a lot of different ways to think about and structure learning collaboratives, but ultimately a learning collaborative is the process of bringing together a community of learners, in our case, from early care and education programs that share with one another, that learn from their collective experiences and challenges, and really just helping them to create networks of providers and to dig into resources and community services that are out there in the community that they may not know about. Learning collaborative participants support and encourage one another as they go through that process of change. They grow and evolve together. They practice new skills and share their progress. They explore research and resources. And then ultimately, they celebrate all of the great successes that they made through the Learning Collaborative, and they learn how to sustain those changes together. For Learning Collaboratives, we recommend recruiting between 10 and 25 programs. And I know that's a pretty wide range, but depending on the programs, the number of programs in your area, I think that having a Learning Collaborative of 10 programs is great, but more is better because that equals more shared experiences and things like that. So we encourage around that many programs to participate in the Learning Collaboratives, depending on the number of consultants that are going to be working on the project. So we encourage all types of programs to be invited to the Learning Collaborative, including center-based programs, family childcare, Head Start, military childcare, and the many other types of programs. We found that there are a lot of benefits in bringing together different types of programs to learn from one another. And then we realized after they've met several times, they really gain a greater appreciation for the different types of care that are out there as well. We use a leadership team approach in Learning Collaboratives, which is the diagram on the right side of the screen. So for center-based programs that participate, we ask for them to develop a leadership team. This usually consists of 2 to 3 individuals in various roles at the program, such as a director or owner, a lead teacher, food service personnel, assistant director, anyone in those kinds of positions at the program. And then we really feel like in order to be very successful with the program, though, the leadership team has to include the owner or director because they really just are there to help manage the changes that are being made at the program. And ultimately, they have the final say in what's done at their program, right? So leadership teams come together for the learning sessions to dive into new ideas. They go back to their programs and talk with their staff about the ideas and test them out. Then the leadership teams come back together during the learning sessions. They share their experiences of working in their program, and then they strategize on ways to keep moving forward. For home-based programs, of course, it's usually just the owner, the provider that's on the team. And sometimes group homes might actually have an assistant teacher that'll participate in the Learning Collaboratives with the provider, or perhaps a member of one of the families they serve might join as well. Next slide. So here are the Learning Collaborative core components, and we'll start with learning sessions. So all of the learning sessions in the Better Together curriculum are very interactive, and they provide a lot of opportunities for participants to engage in the sessions through discussions, time for networking, connecting providers with local resources and service providers, and also many physical activity breaks are throughout the learning sessions as well. Learning sessions are held on a regular schedule over 3 to 4 months, and then the Learning Collaborative framework gives programs a structure to walk through the 5-step improvement process of Go NAPSACC. Action periods are a time after the learning sessions for leadership teams to come together to walk through the action planning process using the Go NAPSACC tools. The process starts with the completion of a Go NAPSACC self-assessment to get a clear understanding of the current practices to help the providers to find their strengths and perhaps some areas for improvement that they might work on. During the action periods, the leadership teams provide education to their broader staff at their program, and they brainstorm together ideas for areas of improvement to work on together. For technical assistance, I really love the technical assistance piece because consultants or trainers are able to really customize how they support each program. They're able to figure out and find the ways that the providers need the most support and to be able to provide that support to them to help them reach their goals. So programs help to identify the areas where they feel change is feasible in their program, and then the consultants provide support to help those programs make those changes, whether that's providing guidance or providing resources or materials or helping make connections in the community. There's a lot of different things that the consultants can do to help tailor that support that's provided to the ECE programs during the technical assistance. And then finally, celebrating successes and outcomes. So we always end the Learning Collaborative with a session focused on celebrating the many success stories that ECE programs share. And after the sessions, programs complete the second self-assessment, which completes the Go NAPSACC 5-step improvement process. Next slide. So through Better Together, we developed 4 modules with each focused on different content areas. They are physical activity, child nutrition, breastfeeding and infant feeding, and screen time. So for a Better Together implementation with the 4 states that we mentioned before, we actually combined all 4 of these modules to make one 10-month-long learning collaborative. And after receiving some feedback from consultants and ECE programs about how tough it was for the programs to complete the full 10-month program, we redesigned the materials to create 4 shorter learning collaboratives with a singular focus for each. So implemented separately, each one of these learning collaborative modules can take between 3 and 4 months to complete the full process. And then we also wanted to share that all of the modules include resources that you can use in your childcare programs. They're resources for children and activities, for staff and for families. All of the modules include guidance for adding new practices and early care and education program policies, and then also tools to help programs continue the process of change. And then I'll turn it over to Viva to talk about the structure of the learning collaboratives.
So as Callisti mentioned earlier, we were kicking off Better Together actually in April of 2020. So we quickly had to change our focus and move to a virtual presentation. As a result, we took what were supposed to be 6-hour full day learning collaboratives and broke them into 1-hour sessions, since we were doing that all on Zoom like this. And the reality is that there were some benefits of those shorter chunks of time. It allowed for people to learn materials, go back, start taking action, come back, learn more. So as we've created the more long-standing Better Together collaboratives, we've kept that option there. So what you see across the top are the 4 learning collaborative contents areas that Callisti mentioned. And then what you see going down this chart is an example of how that works in real life. So the yellow information are the provider training sessions, those learning sessions. Each block is a 1-hour block. We put them together so that you could easily combine two blocks together for a 2-hour block if you wanted, but then there really are steps to start taking action. So after you come together on the learning sessions, as you can see here on this slide, you start off with an overview and orientation to the collaborative as a whole, and then session 2 is a Go NAPSACC orientation so that the program can establish their account and get working in Go NAPSACC. There are a few of these learning sessions that are really a review of the Go NAPSACC best practices for that module, whether that be physical activity or child nutrition. These sessions, there are 2 ways you can present them. Here you see either RT, which stands for a recorded training, or CL, which stands for consultant-led. So it is your choice. The slides, the PowerPoint presentations we have come with full scripts. You could do them consultant-led, or you could give that as an assignment that people would watch that material on their own. For infant and child physical activity and child nutrition, there are 2 of those recorded sessions out of a total of 8 1-hour learning session blocks. For breastfeeding and infant feeding and screen time, which are slightly shorter learning collaboratives, there is 1 recorded session to go in their 6 1-hour learning session blocks. In between, you see the light purple. The light purple are kind of very basic instructions for what the consultants are doing during that time. So the consultant, after they've done the initial orientation of Go NAPSACC and the learning collaborative, are working with the providers to get them comfortable with Go NAPSACC. That's the first light purple. And then as you move on, as providers complete the self-assessment and have more knowledge, it's the consultant's job during that time to review the self-assessment with the provider and talk about their action plans. So there's direction throughout the learning collaborative materials on not just what happens in the actual learning sessions, but also how to guide the work in between in the action periods. On this chart, you also see the dark purple, slightly darker purple. That is the task that the provider is taking during that action period. So whether you want to think of that as assignments or whatever, but it's moving them through that process from taking the content that they learned and the conversation they've had with other providers in the learning sessions and putting it in action in their program. So they move on. Session 3 and 4 are much more content-based, as Khaleesi mentioned, with lots of interaction and time to discuss as a group. And then as you move on, the last 2 sessions of each of the learning collaboratives, or the last session, includes that celebrating of success. So we both have providers bring examples of what the changes they've made in their program so they can share that with other programs to continue to inspire people moving forward. We also have information to connect them with other initiatives and resources in their community so they can continue their learning. So just to see on this chart, it is about 8 hours of learning content for child nutrition and physical activity, about 6 hours of learning content for breastfeeding, infant feeding, and screen time. And therefore, as you do sessions, and then you have a week or 2 to implement actions, and then you come back for your next session. And whether that be in person or virtual, within the Learning Collaborative PowerPoint, there are tips for both. So we have adapted the material so truly you can very easily take it from the resources you have to full implementation in either world, either a real in-person world or a remote world. Here's an example of what that looks like in physical activity. So as I mentioned before, session 1 and 2 are your orientation and your introduction. You're getting to know each other. You then move on to an action period. Session 3 and 4 are those contents. And then the session 4, the best practices part 1, as I mentioned, is that opportunity for either a recorded training or a consultant-led. Come back for session 5 and 6 for more learning. And then session 7 is talking, and then going back to your action periods where you're starting to really implement new changes in your program. Session 7 and 8 is last learning around daily practices and engaging families, and then ending with our celebration. And as Khaleesi mentioned also, the last step is to retake the Go NAPSACC self-assessment. So both the program and you as the facilitator of these groups are able to see the changes. So with that, we've talked about Go NAPSACC being fully integrated into the process. So we just want to kind of let you see what Go NAPSACC looks like. At the core of this image, you can see the 7 Go NAPSACC modules. We have 4 that are incorporated into Better Together Learning Collaboratives, but there are 7 full modules. So there's child nutrition, breastfeeding and infant feeding, farm to ECE, oral health, infant and child physical activity, and outdoor play and learning. And we have incorporated some outdoor play and learning in the physical activity learning collaborative for Better Together. And then lastly, the reduction of screen time. Surrounding those modules is the 5-step improvement process, which really is everything we've been talking about, right? You're starting off with assessing where your program is currently. You're working on action plans for what you want to change. You start to make the changes. There's opportunities to learn more inside of Go NAPSACC, which I'll show you in a minute. And then lastly, you come back and retake that self-assessment. So with that, I am going to briefly show you what Go NAPSACC looks like. And if someone can confirm they can see the website, that would be great, or I'm going to trust people can.
Looks great.
Thank you. So within Go NAPSACC, if you are new to Go NAPSACC, there are two main types of accounts. One is the child care program account. And one thing to know about Go NAPSACC is Go NAPSACC is a program-based intervention. So you're looking at the practices of a full child care program, not an individual teacher or classroom, but what's happening in the program as a whole. On the left here, you can see those 7 modules I mentioned, and across here, the bars are simply where a program has actually taken a self-assessment. So, and then here on the left, green navigation bar, you can see the steps of the Go NAPSACC improvement process that I mentioned. So just to very quickly show you what the provider tools look like. In any of those 7 modules, they can start off by taking a self-assessment. And that's simply what it is, right? It's a questions about their child care program. In this case, we're starting in child nutrition. So the first questions are about foods provided. And so a child care program, if they were in the Learning Collaborative, after they did their initial orientation, they would take kind of a baseline self-assessment in child nutrition to say, honestly, where are we now currently as a program? So they answer these questions. We start off with the foods that are provided to them. Every time they answer a question, they finish that page, they hit continue. The second topic in child nutrition is beverages provided. They then move on to questions about the feeding environment. So they would continue to check. They might have to talk with their cook in their program or other people to learn about how child nutrition is handled in their program, if that's not their specialty. You've seen probably throughout this self-assessment that there are places where it's underlined and there's this little information symbol. On any of those, the provider can hover around those and get a definition of the item. So they can simply hover and there's the definition. In some cases, that definition is very simple, such as what is a preschool child, but making sure they know what Go NAPSACC uses that definition. Sometimes it might be something a little more confusing, such as what is an authoritative feeding style, but there's there to help them as they answer the questions and they continue to move through. Once they have completed their self-assessment, they're able to get their results where they are able to see exactly what they answered and what the best practice is. So nowhere in Go NAPSACC is the goals hidden. They know exactly where they're moving towards and what we're working towards. The next stage of that process is action planning. And in action planning, they are given a starting place. So Go NAPSACC has for every one of those best practices, every one of those self-assessment questions, there is a pre-populated action plan to get them started. This is one that I've saved in the past. You can always edit it. You can add steps. You can rearrange them. You can add additional notes about how it's going to work in your program. As with any change process, we really encourage the program to personalize it to their needs. We want to make sure that they have thought through how are they going to make this reality in their program. And as Callisti mentioned, and I've mentioned, they have their consultant to help them throughout the process. So then once they have their action plans, and for each of the learning collaboratives for child nutrition and physical activity, we're encouraging programs to write 4 action plans. For breastfeeding and infant feeding and screen time, which are a little bit shorter, we're suggesting they write 3 action plans. Once they've written and saved their action plans, there are other materials here in addition to what's in Better Together to assist them in moving forward. And so we have a resource library. And so as we were just looking at child nutrition, each page of that self-assessment is a category, and those same categories follow here in the tips and material library. So if we were looking at feeding practices, I have materials available to be automatically for teachers and staff, for family engagement. They are available simply to click and download straight to your computer. And wherever possible, we have them both in English and in Spanish. And this includes some short videos and other things for providers to start thinking about the topic and putting into action. These have all been saved directly into Go NAPSACC. So a provider isn't taken out to the web where they start clicking around and they might find something that isn't really what we're hoping to reach. So they're really saved all here to support their growth in these areas. Go NAPSACC also for each of those areas has half-an-hour training. So again, you see those same categories we've seen throughout. While these trainings aren't directly a part of Better Together, we did see programs in our learning collaboratives use these with other staff members. So for example, as Caliste mentioned, your leadership team might have 3 members, but your rest of your staff might also want to learn more. So if you're working on feeding practices, you could ask the rest of your staff to watch this half-an-hour training on that topic. So it's a great way to help share with them the learning that's happening in Better Together, in addition to resources Better Together have specifically to share with staff. In most Go NAPSACC states, these online trainings have already been approved for professional development credit in those states. If you want to know more about that, you can always reach out to your state lead on the Go NAPSACC map to learn more. But we did find these resources to be complementary to the process of Go NAPSACC. So that's really what I wanted to show people in Go NAPSACC, so they really understood how Go NAPSACC is complementing and moving programs through the learning of the Better Together Learning Collaboratives and helping put it into action in their program. The other kind of account that I'm not going to show today is a consultant account. And from the consultant account, the consultant can see all of the work of the provider. So when the provider takes that self-assessment, the consultant can see the results, review them themselves, and be ready to have the conversation with the provider. So it's really a great way for them to touch base with the provider, to share with them. The consultant has all the tips and materials, so they can also download resources, email them to the provider and say, hey, I think this one would go really great with the action plan. You might want to read it and think about how it helps you. So it's really a very complementary process. So hopefully that gives a little bit of an overview for Go NAPSACC and how it helps move programs through the Better Together change process, as well as other opportunities within a state.
Thanks, Aviva. So let's talk a little bit about the resources and materials that we have available through Better Together Learning Collaboratives. I believe we were really thoughtful about the way that we put together these materials to be able to provide all of the support, guidance, and even in some cases, just general direction about how to go about planning and implementing a learning collaborative. Next slide. And Viva, you'll have to work with me, you know. So the implementation toolkit. So this is a great guide for anyone wanting to host one or more learning collaboratives. And this toolkit walks you through the entire process of planning and implementing the learning collaboratives that we've talked with you about today. We've included tips and ideas to consider. We've included examples of how the Better Together learning collaboratives were implemented in the 4 states. One more time. And as you can see, or you may not be able to see as well on the table of contents, we split the guide into 2 different sections, a planning section and an implementation section. And it really just walks you through that entire process. And what I really like about the implementation toolkit is that it's really adaptable. So someone that is a state level coordinator that's looking to host multiple collaboratives in different regions of the state can use this implementation toolkit to plan out the learning collaboratives, or a trainer that's working in rural Alabama that wants to work with and provide a learning collaborative to providers they're already working with can use this toolkit to plan and develop the learning collaboratives for those particular programs. So whether you're thinking about large implementation across many different regions or a singular learning collaborative in one particular region, we've tried to adapt the materials and the content to meet your needs. Next up are the resource guides. So we have 5 different resource guides. The first is an overall resource guide that includes all 4 of the content areas. And the resource guides are for the childcare providers that are participating in the learning collaboratives. They are a compilation of resources for the different content areas, and they also include different types of worksheets that a childcare provider might use, the leadership team might use to help support the work that they're doing with their childcare program. It might help support the training of the childcare providers that are at their program. So this is the cover of the resource guide that has all of the 4 content areas. And as you can see, it's broken down into the different modules. So we have the orientation sessions, and we have some resources for the orientation sessions and the Go NAPSACC orientation that is part of the first training series. And then we have it broken into infant and child physical activity, child nutrition, breastfeeding and infant feeding, screen time. And then the last section is the sustaining healthy changes section, where there's actually a really nice worksheet there that helps providers think through all the great changes that they made throughout the Learning Collaborative and to help them plan for sustainability moving forward with their childcare program, even though the Learning Collaborative had probably ended at that point. Next. So we took that overall resource guide and we created individual resource guides for each one of the content areas in case you want to utilize just the physical activity resource guide, or if you click again, it'll show the child nutrition resource guide, or the breastfeeding and infant feeding resource guide, or screen time. So we have resource guides for each one of them. And I'll share that the screen time cover, the picture is my most favorite picture that I've seen in a really long time, because the kid on the left is just so joyful and just so into the activity that's being done. But anyways, we also have really great PowerPoints with notes. So everything you need to host the learning sessions are actually found within the PowerPoints. We've provided a suggested script for each one of the slides, and those scripts can be modified by each consultant or trainer to include personal stories, or to modify to include local resources that are available that you want to share about during the Learning Collaborative. And as you can see, this is just the image of the PowerPoint slide, an example slide. Next. Then we also have recorded trainings for the best practice sessions, and each one of the modules has a couple of best practice sessions. Well, the physical activity and child nutrition module has 2 best practice sessions, and the other 2 modules just have 1 best practice session. But these sessions can be provided live by the consultant. They're all included in the PowerPoints with the notes. Or we've also taken the time to record these sessions so that you can use these instead of hosting the live trainings for the best practice sessions. You can use the recorded trainings so that providers can just complete them at their own pace. So depending on how busy your providers are or how much time they have to devote to this, the best practice recorded trainings are a really good option for those that really want to have some time to go through some of the tasks on their own. And on the screen is an example of one of the best practice slides. So how do you access the resources? So there's 3 different ways you can access all of the Better Together Learning Collaborative resources. The first is through the implementation toolkit. So on page 2 of the implementation toolkit, there are links to almost all of the resources that we've made available for the Better Together Learning Collaboratives. So everything you need to implement the Learning Collaboratives is a download away through each one of the links in the implementation toolkit. Next. We also have a Basecamp page dedicated to Better Together Learning Collaboratives. And if you are in a state that has a Go NAPSACC license, you can email us and you can let us know that you want to be added to the Basecamp page, and we can send you a link to offer you the opportunity to join that Basecamp page, and you'll have access to all of the materials. And then you can also access all of the Better Together Learning Collaborative materials through the Go NAPSACC consultant account. And Aviva can share with us a little bit about how to find those.
Sure. So in your Go NAPSACC consultant account, there's a consultant resources page that includes a wealth of resources to help a consultant do their work, from recruitment materials, orientation, presentation for Go NAPSACC, all kinds of materials. But one of the resources that's available is the Better Together Learning Collaboratives Implementation Toolkit. So that is on the consultant resources page under step 4, learn more. If you go to support documents, if you're already a Go NAPSACC consultant, you'll be able to find the implementation toolkit already there.
Thank you.
Lacey?
That's all. Are you going to go through these slides? I'm sorry. So the Better Together implementation toolkit really walks through, and the next two slides are about planning and implementation. So we thought we'd share with you some ideas about planning and some ideas about implementation. And all of these resources are found in the implementation toolkit. So in planning your learning collaborative, some of the first things that you need to decide on are, will you host the learning sessions in person, virtually, or a mixture of both? So in Arizona, just for example, and I believe that Bonnie is joining us today, Arizona hosted all of their sessions virtually, but then they had towards the end, whenever they were able to go back in person in some ways, they had some of their technical assistants in person. And then in Arkansas, they actually hosted all of their learning sessions virtually, and then the very last session they hosted in person, and they felt like that really made a huge difference to help build those connections and networks among the childcare providers. So the next thing that you really need to decide is who will deliver the learning collaborative content. So will you work, is it yourself? Will you be the consultant that is working with the providers to host the learning collaboratives? Or are you a state director that is looking to think about hosting the learning collaboratives in different areas of the state? So then you would have to consider, where will you get the consultants? Where will they come from? What part of what network are they already a part of that they can reach childcare providers? Then you'll need to decide what modules are actually going to be included. So are you going to do a single content area module, or will you do a combination of modules? And that's going to depend on the amount of time that you have. So if you only have 4 months, then you most definitely want to do a single content area learning collaborative. But if you have a full year and you have providers that you've worked with some time and you already have a relationship with them, you might want to consider combining 2 or more of the learning collaborative modules to make a longer learning collaborative. And then you should decide about how long the learning sessions will last. So we definitely recommend for virtual sessions to not do any longer than 1 hour. I know that even my attention span, I can't join meetings for more than 1 hour most of the time. But if you're going to do an in-person session, you might want to consider combining 2 or more of the content areas, the learning sessions, to create longer sessions to make it really worth the while of the provider to drive to the place and to be able to go through that training content. Next slide. And then at the end of the planning and implementation portions of the implementation toolkit, there's actually a checklist that walks you through each one of the steps to get to the place to where you can implement your learning collaborative. So this is just an example of the implementation checklist and many of the things that you might want to consider as you're going through the process of planning and implementing your learning collaboratives. And so we have with us today Megan McKinney Cooper, who is the communications director at Jump In for Healthy Kids. She was the Better Together state lead at Indiana, and she's still working on implementing nutrition and physical activity strategies in Indiana. So we thought that as a closing for this work and for this presentation, that it would be great to hear from Megan about her future plans and how her experience with the Better Together Learning Collaboratives. Megan?
Thanks so much, Callisti, and we're really happy to be able to share our experience in Indiana with Better Together. I'll start by saying that Indiana is a state that does not have robust nutrition and physical activity requirements in our licensing or even in our QRIS. So it's important for us to sort of be nudging the providers in the state to be sure to be incorporating this kind of work, since it's work that a lot of them are not exposed to when they're being set up or in their ongoing professional development. And slowly we are finding ways to get Go NAPSACC embedded in some of the state systems so that more providers are exposed to this and able to make this progress to, improve the quality of the provider environment that they offer and also to have healthier kids. So I'll start by explaining a little bit about how Indiana is structured. We have a company called Spark Learning Lab that implements technical assistance across the state, across all of the different domains, not just Go NAPSACC in nutrition and physical activity. They do every kind of professional development and coaching for all providers, not just licensed and not just on our QRIS system, but actually all providers. So when we first embarked on the Better Together project, we enlisted partnership with Spark Learning Lab to be sure that they were on board and that they were willing to actually implement these learning collaboratives. And Spark was actually a new company forming in Indiana at the time. And so as they were designing how their technical assistance was being delivered, we were able to embed the Go NAPSACC tool and this content into the way that they were providing technical assistance. So the nutrition and physical activity best practices are part of the whole library of technical support that they offer to all of the providers in the state. Spark and Jump In for Healthy Kids recruited providers across the state. One of the benefits of being sort of forced to offer the learning collaboratives virtually is that we were not restricted by geographic barriers. So we didn't have to make sure we clustered all of our providers in certain sections of the state. We could have them spread out because they were all tuning in virtually. So that is one advantage. And our coaches and technical assistants really adapted quickly to be able to provide TA and teach the courses online. And all of the providers were also able to network still. And oh, I'm getting a question. Hold on, I'll come back to that in a minute, Bonnie. They were all able to adapt to the online classrooms. The Go NAPSACC tool is extraordinarily user-friendly. And so the providers were engaged and able to work their way through each of the domains that were offered. So this has been part of a broader campaign from my organization to embed these nutrition and physical activity best practices in the state systems. So being able to get this into the Spark Learning Lab state technical assistance has really been a huge step forward. And a lot of what this slide explains that I'm going to get into now is how we are able to keep this going even after the Better Together project has ended. So Spark has really run with this, and they were able to get some stimulus funding, and they have actually expanded how they're offering their nutrition and physical activity coaching by offering ongoing learning collaboratives. So they've recently just hired 5 mental health and wellness coaches who are going to facilitate the content for these collaboratives. They're going to be 12 weeks long, each one. And of course, the content for these is coming from the Better Together project from Nemours and Go NAPSACC. They're going to not do them all concurrently. They're doing one at a time. So if you look at each learning collaborative being 12 weeks, it will take a full year to work through all 4 of these modules. They're still figuring out the order of the modules, but we've had a lot of lessons learned from the Better Together project. And Spark has really made mental health and physical wellness a priority for the work that they are doing. So they've already mapped out the details. They're going to have 10 to 12 programs for each collaborative. They're going to be using these health and wellness coaches to facilitate and provide TA. They're going to offer the sessions virtually, but their goal is to offer the direct technical assistance in person and on site. And they have set up a system through groups where the programs can, have peer-to-peer learning and utilize one another for best practices that they've learned. And they can also share photos and testimonials and stories about the progress that they make to celebrate each other and to help each other out as they work their way through their action plans. And they will receive state professional development training credit for their time spent in this. So we are delighted as a state that Spark has been prioritizing nutrition and physical activity as part of the work that they're doing. We're delighted that all providers have access to this if they would like. And we're very happy for the State Department of Health that is funding our Go NAPSACC license for the next few years, hopefully longer. And we're also very grateful to Nemours and UNC for this incredibly high quality and thorough and user-friendly tool. So we're really happy that we're making this progress in Indiana. And I'm happy to take questions. Bonnie had a question. Let me open it.
Yeah, she asked if Spark is funded by the CCDB funding.
I believe so. Spark does have the state vending contract for providing all of the technical assistance. So I believe that is how it's funded.
Awesome. Thanks, Megan. Any
Yeah,
other
thank
questions for Megan? Thanks again. So we're not going to share this with you during our call today, but I have included a link in the chat to this Better Together provider testimonial from Norita in Indiana. We fell in love with Norita as we created these testimonial videos at the end of the Better Together project, and we thought that we would share it with you all. Feel free to watch that on your own time. Next slide. And after hearing all about the resources that are available through the Better Together Learning Collaboratives and even Indiana's experience with Better Together, you might be interested to hear about some of the outcomes of the Better Together Learning Collaboratives that were implemented in the 4 states. So keep in mind that the Better Together Learning Collaboratives were implemented from 2020 to 2022 in 4 states, and they included all 4 content areas and took place over a 10-month period of time. So a little bit different from implementation of the one module approach that we have been talking about mostly. So we took a staggered approach for the completion of the Go NAPSACC self-assessments in each of the content areas. The first self-assessment for each content area was completed prior to delivering each module's learning session. So before any content was shared, to get a baseline of the best practices being met, we had the providers complete the first self-assessment. The second self-assessment for each module was completed after programs finished their action plan implementation in order to really capture all the great changes that the programs made through the Learning Collaborative. So the numbers on the far right indicate the change in the % of Go NAPSACC best practices achieved. So for physical activity, we saw a 19% increase in the Go NAPSACC best practices achieved. For child nutrition, it was 12% increase. Breastfeeding, infant feeding, 17% increase. And for screen time, it was a 12% increase. So as you can see, those are really substantial changes that were shown through the providers implementing more best practices throughout the Learning Collaborative process. So do we have any questions? You can feel free to unmute or you can add in the chat box. But while you all are thinking of questions, I just want to share that for more information about Better Together Learning Collaboratives, please feel free to reach out to either myself or Aviva. We're glad to support you however we possibly can and to answer any additional questions that you might have. We also have a very brief feedback survey we'd be honored for you all to complete. So Hannah's going to add the link to the chat, or you can also scan the QR code on the screen to get to the survey. The survey also provides you an easy way to request a copy of the Better Together Learning Collaborative Implementation Toolkit, and to also be added to the Better Together Basecamp page, so where you'll have access to all of the materials, either through the toolkit or the Basecamp page. There's a question at the bottom of the first page that asks if you would like to receive access. And then you have to provide your contact information on the form in order for us to be able to send those materials to you. Does anyone have any questions? All right, next slide. So we mentioned at the very beginning that this is part 1 of the resource showcase. Part 2 of the resource showcase series is going to be on March the 7th. So we're going to be sharing about the wellness workbook and how to navigate those web-based tools. The wellness workbook helps ECE providers to assess, develop, and monitor the program's wellness practices and wellness policies. And the wellness workbook website is now available in English and in Spanish. We're also going to share more about the open source learning collaboratives that we've mentioned throughout today's presentation. So modeled after the Better Together Learning Collaboratives framework, this version is for any organizations or trainers interested in implementing learning collaboratives that in states that don't have a Go NAPSACC license at the moment. Next slide. And I just want to say thank you for joining us. I hope that you have learned a lot about the Better Together Learning Collaboratives. If you have any questions or need any additional support, please feel free to reach out to any of us at Nemours or Go NAPSACC, and we are more than glad to support you and provide the help that you might need. And we'll see you all on March 7th. And we can stick around for just another moment in case anyone has any questions. Have a great day and rest of your week.